There are 3 different incisions that we use to perform breast augmentations. The most common incision used to perform a breast augmentation is the inframammary crease or inframammary fold incision. This involves an approximately 4 centimeter incision along the fold or crease of the breast, and through that incision, the pocket is made and the implant is placed. Another common location for breast augmentation incisions is the periareolar approach. So this involves an incision along the junction of the areola and the normal skin of the breast. So at that junction where the skin pigment and texture changes, an incision is made, and that incision is used to access and create the pocket for the implant as well as place the implant. This is usually from 3 to 6 o'clock along the areola. And finally, another incision used to perform breast augmentation is the axillary incision or an armpit incision. And this incision is used in the same way as the other incisions. We incise the skin at that location and then a pocket is created. The same pocket's created in all 3 approaches, but a pocket's created through that incision and then the implants are placed through the armpit incision. So the main deciding factor on which incision is best for you depends on where you would most prefer your scar. You have to have a scar if you're getting a breast augmentation. We need some way of accessing the implant pocket to both create the pocket and place the implant. And then you need to decide where you want the subsequent or resultant scar to be. The most common one is the inframammary crease incision. This is generally the least painful location and does not have an effect on your nipple sensation. The next most common incision is through the armpit. This has the advantage of keeping the scar off the breast, but it puts a scar in your armpit. So it's up to you to decide which one you'd rather have. And then finally, the periareolar approach it has the advantage of kind of hiding the scar along a natural junction in skin texture and tone, but it is the most likely incision to change your nipple sensation. So those are the 3 incisions and subsequent scars that can be used to perform breast augmentation. They all have their pros and cons. It really comes down to figuring out for yourself what matters most to you, and that can help you and your plastic surgeon decide which incision or approach to a breast augmentation is best for you. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.